Hello, today is 29th September. We are observing World Heart Day. Yes, every year we observe this in order to create awareness regarding the prevention of heart diseases. This video is prepared and made from the platform of Association of Pakistani Physicians and Surgeons of Middle East. It is urged kindly share this video with your friends, families and surroundings in order to create more and more awareness. This year, the slogan of the Heart Day is use your heart for every heart, and under this slogan there are three pillars. Number one is use your heart for the humanity. 75% of deaths of the cardiovascular diseases occur in low and middle income countries. The second pillar is use your heart for the nature. According to the estimation, 25% contribution of the deaths from the air pollution. And the third one is use your heart for you. The psychological trauma double the risk of the heart diseases. So therefore, actually, it is very important to work together in order to prevent the heart diseases. Before going to move forward, let me introduce myself. I am Dr. Khan, working as family physician and head of the Department of Family and Community Medicine, College of Medicine, Saudi Arabia, King Faisal University, and I am also the members of Association of Pakistani Physicians and Surgeons of Middle East. By year 2030, UN decided actually to reduce the burden of the heart diseases at least 1/3. Before going to move forward, let me show you what is heart. You can see it is a plastic model in my hand, and this is the real shape of the heart, and the heart shape which you actually receive in the WhatsApp group or the other messages, it's not rare. And you can see inside it has actually the chambers, and these chambers are very important for actually distributing the blood in your body. This heart is almost one fist size, 0.28 kg. It has electrical impulses to control the functions, and also the functions of the heart is controlled by your brain, and it is very important organ to supply the blood, nutrition, everything to your body by pumping the blood into your body. So heart is so important. The heart disease is a leading cause of death worldwide. Let's have a look of some data. An estimated 18 million deaths occurs in 2019 from the heart diseases, and 32% of all deaths in the whole world occur due to the heart diseases. And out of these, 75%, as I told you, that occur in the low and middle income countries. According to the estimation, 17 people died prematurely, means under the age of 70, and out of these 38% because of the heart disease or the strokes. The situation in the Middle East is also not very changed or different. Almost 1/3 of the deaths of the total pool is occurred due to the heart diseases. Similarly, in Pakistan also the death is very high, and according to the WHO estimations, 2,500 people, 250,000 people, died during the year of 2020. So very alarming situation. Also, Pakistan having another actually problem, that the young population also suffering with the cardiac disease or heart disease because of the risk factor of the cigarette smoking, as well as the sedentary lifestyle. So situation is so alarming in Pakistan and lower and middle income countries. In order to prevent these diseases, we need to actually follow some preventive measures. But before that, we need to understand how heart attack happens. The heart attacks actually means that the supply, the blood supply to the heart, you can see here red colored lines, okay, and these are the small arteries, like a small pipe. They are supplying the blood to the muscles of the heart. If they are going to be blocked, it means the muscle will not function, and if it will not function, will not be able to circulate the blood. So because of that, the heart attack will occur, in simple language. So in order to reduce this heart attack, we need to actually focus some risk factors. And what are the risk factors? The major risk factors are sedentary lifestyle, junk food consumptions, lack of sleep, and excessive smoking, also the stress and alcohol use. If somebody has heart attacks, what are the symptoms of the heart attacks? The chest pain, chest discomfort. The discomfort can feel like uncomfortable pressures, squeezing, fullness on the chest. Also pain and discomfort in the neck, jaw, and the shoulder, and also feel the shortness of breath, fatigueness, or sometimes discomfort in the both arms. But some of the symptoms are different in the women or the females. For example, they feel actually nausea and vomiting, cold sweat, lightheadedness, unusual fatigue, and heartburn. So please be aware of these symptoms. According to the WHO estimation, 80% of heart diseases can be prevented by actually only taking some preventive measures. How? Well, it is easy if you're ready to modify your lifestyle. So let's talk about the lifestyle modifications. We begin with the balanced diet. Yes, start having a balanced diet. What is the meaning of balanced diet? It is a big topic, but just let me tell you quickly and briefly that plenty of the fruits and vegetables, at least 5 portions of the day, whole grains, nuts and foods, low saturated fat, no sugar or less sugar, no salt or less salt. This is called balanced diet. Avoidance of the junk food, and at least having 8 ounces glass of water per day. Then please start doing exercise regularly. Adult above 18 years, 30 minutes per day for 5 days per week are enough from moderate to severe exercise, and below 18 years, 60 minutes per day for 6 days are enough. Let me tell you that if really you want to actually avoid to have a specific exercise, you can just modify your lifestyle. For example, you park the car from your destinations a little far away and then walk. And also, if you are using the bus, just drop by 1 or 2 stops before your destinations and then walk. Also use actually masjid where you are going for the prayers, a little bit far away from your house. So just modify your day-to-day lifestyle. Instead of using the lift, please use the stairs. Then it will become a substitute or replacement of your regular exercise. Hopefully you will adopt this modification, and inshallah you will get benefits. Maintain appropriate body weight. How would you know that what is the appropriate weight? Please use Google Uncle, and you can use the Google Uncle and find out that what is your body mass index, your weight, and as well as your height, and according to weight and height, what should be your ideal weight. And then according to that calculations, you are going to actually reduce your weight and follow the diet chart in order to reduce your weight. Avoid tobacco smoke. Smoking, either is active or passive, both are dangerous, and there is no level which you can say it is a safe level. Avoid alcohol also. Alcohol is dangerous, so please avoid alcohol. Manage stress. Stress, as I told you, that it doubles the risk of the heart diseases, so please manage your stress. If you don't know how to manage this, at least start playing chess. No problem, at least you will keep yourself busy. If the things are out of your hand, don't be afraid. Talk to your family doctors, and family doctor will actually decide whether you will be referred to the psychiatrist or continue some kind of management or counseling. At the end, I would like to suggest know your numbers. A number means that your blood pressure, whether it is high or low, your blood cholesterol, whether it is high or low, and your blood sugar, whether it is high or low. These are very, very actually high risk factors, and if you know the numbers, you can actually use the chart you can see on the screen. These charts can be used in order to measure your risk for developing the cardiac problem or the heart diseases. You can talk to your family doctor in order to understand what is the meaning of these charts and how you are going to actually calculate and prevent the problems before it is going to be actually create more problem for you. These charts are different for different countries. So Middle East chart is different from the rest of the world. So please be careful about that. If you know and determine your numbers, and you already talked to your actually family doctor and you know the risk, then you can apply the approach which is called ABCS approach, and according to this approach you are going to manage your heart disease problems, or you can prevent further complications of your heart disease. At the end, I finish here by saying take care of yourself, and remember this year's slogans, this World Heart Day slogan, that is use heart for every heart. Thank you very much. Take care of yourself.